Hi, how are you? I hope you're having a great day. We are born with an immune system that works with our adaptive immune system to protect us against infection, which lets our body know when or if injury occurs. Our innate system is what we're born with, and our adaptive system, which responds to pathogens to save us from death by infection and creates a memory of those pathogens for future attacks. Today, we'll take a look at how this process works in several specific pain conditions, including fibromyalgia, complex regional pain syndrome, rheumatoid arthritis, multiple sclerosis, diabetic neuropathy, and osteoarthritis, and how they affect our bodies with our immune system. Here we go. In our adaptive immune system, not what we're born with, T cells are there to kill, regulate, or immunosuppress antigens, which are toxins or foreign substances in the body. This is a very complex process, but I'll try to make it simple. So let's start with B cells. They release antibodies in the adaptive immune system. And T cells release signals to activate B cells. Both of them are called lymphocytes. The innate immune system is magnified to eliminate the antigen. It's a fascinating process. Central sensitization was first coined about 30 years ago. The activation of C nerve fibers in the peripheral nervous system, the nerves located outside our brain and spinal cord, can become repeatedly activated due to the synaptic plasticity in the nervous system. Plasticity is when the organism is able to change or be molded like plastic. Neural plasticity, also called brain plasticity, is the ability of the nervous system to change in response to stimuli. These neurons have the ability to modify their strength and is a normal process in the central nervous system. Plasticity is important for learning, growth, development, adapting to our environment, mental health, protection against pathogens, and so much more. In many cases of chronic pain, there's an increase in the circulating pro-inflammatory cytokines in the blood. Cytokines are substances that are secreted by cells of the immune system and have an effect on other cells. This leads to hypersensitivity, like when you get a cut and it hurts just to touch it. Once the innate immune system is activated to defend our bodies against a pathogen, which is a virus, a bacterium, or other organism that can cause disease, the adaptive immune system is activated, including lymphocytes like T and B cells. Neutrophils and macrophages are cells responsible for the destruction of pathogens. In the central nervous system, microglia are the acting macrophages. Unlike macrophages, microglia can change form. They go out and search for damage and infectious agents in the brain and spinal cord. We need them. Microglia are typically oval-shaped and have slender, elongated processes that project out from their cell bodies like tendrils so they can move around. They will clear cellular debris and dead neurons through a process called phagocytosis, or cell eating. In the brain and spinal cord, microglia, our innate immune cells in the central nervous system, become active within 24 hours and peaks in the spinal cord at around 1 to 2 weeks. Their job is to repair and maintain homeostasis in the central nervous system. When infection occurs, a cascade of events that include cytokines, microglia, and other chemicals result in an inflammatory reaction. This is critical to both the health and pathological brain and spinal cord. This process normally ends when the danger has been taken care of. However, in chronic pain, which is pain lasting more than 3 to 6 months, that process remains activated. This is a result of tissue or nerve damage, inflammation, or when no apparent threat is found. Clinical evidence shows that continued pain affects the immune system and vice versa. In fibromyalgia, several studies have found that there are increased levels of cytokines and chemokines that suggest that we are in a constant state of systemic inflammation that could be related to the pathology of fibromyalgia. In addition, leptin, known for activating the immune system, was found increased in fibromyalgia, suggesting the reason for the increased levels of cytokines. Researchers have found that there is a direct link between inflammation and pain in fibromyalgia with increased levels of pro-inflammatory cytokines. The problem is that traditional anti-inflammatory medications do not work in fibromyalgia. Increased levels of IL-1B were correlated to pain. Then, it was found that a significant number of patients have a peripheral neuropathy called small fiber neuropathy. There's a decrease in epidermal nerve fiber density in fibromyalgia. The medication used to treat small fiber neuropathy can also alleviate pain in fibromyalgia. That's interesting. It's plausible that the immune system plays a role in small fiber neuropathy as a peripheral element in fibromyalgia. I know I keep bringing up small fiber neuropathy in relation to fibromyalgia, and this isn't intentional. It just keeps coming up in the literature. I also want to bring attention to a chronic, debilitating, and painful condition called complex regional pain syndrome, or CRPS. Just think regional, in a very specific area. Patients experience severe and continuous pain. It involves inflammation, swelling, joint stiffness and damage, muscle spasms, tremors, and weakness, sensitization, meaning the pain is out of proportion to the severity of the initial injury, like that cut when you touch it and it hurts. And there are other symptoms as well. In CRPS, the importance of B cells in the development and progression has been shown in studies. It usually affects an arm or leg and typically develops after an injury, surgery, a stroke, or heart attack. And many times people develop chronic widespread pain after developing regional pain. I'm wondering if a few of you also experience this kind of pain prior to getting fibromyalgia. One subscriber stated that she had to put her hip back in place when she gets out of bed in the mornings. Could this be the root of her problem? I know that my hips are sore when I wake up, and I have to do a lot of stretching to get the stiffness out. But my joints aren't affected or out of alignment. In osteoarthritis, the most prevalent of chronic degenerative joint diseases, the joints break down and cartilage and synovial inflammation results, and the underlying bone begins to change. Chronic inflammation is evidenced by T cells and B cells and infiltrated macrophages in the synovial membrane. Do any of you also have osteoarthritis? It's usually found in the hands, neck, knees, and hip joints, as well as the lower back. I have it in my fingers, most likely from my hairdressing days. Rheumatoid arthritis is often found in fibromyalgia patients. RA is a chronic inflammatory disease which primarily affects joints, but can affect body systems such as the skin, eyes, lungs, heart, and blood vessels. Swollen, tender, and painful joints are the primary characteristics. It's considered autoimmune due to researchers discovering multiple autoantibodies like ACPA, an antibody, and the rheumatoid factor, a protein produced by the immune system that can attack healthy cells. These antibodies are present long before an individual is diagnosed. T cells are involved, and increased amounts of IL-8 is the initial step of the disease. Then more inflammatory processes begin, which produce pain and inflammation. Multiple sclerosis is a disease in which the nerve cells of the central nervous system become demyelated and damaged. The myelin sheath protects neurons as a supportive coating. When it's stripped away, the nerve becomes vulnerable to injury. This affects only the myelinated nerves. The activated T cells will cross the blood-brain barrier and induce demyelination by releasing cytokines and other factors. Physical and neurological problems result, such as the loss of vision, muscle weakness, loss of coordination, and cognitive impairment. It is most commonly considered autoimmune. Some believe that it could be due to oligodendrogliopathy, which is found in other neurodegenerative diseases and aging. Pain is a common symptom. A common nerve disorder that affects about half of those with diabetes is called diabetic neuropathy. It's caused by high blood glucose due to diet and the development of type 2 diabetes mellitus. Symptoms depend on where and the type of neuropathy, but general symptoms are numbness, tingling, and pain. Peripheral neuropathy is the most common and involves the feet, legs, arms, and hands. Autonomic neuropathy involves the digestive system, eyes, lungs, and bladder function. It can also affect the heart and blood vessels, which can cause changes in blood pressure. Proximal neuropathy affects the hips, the buttocks, and legs. Focal neuropathy can occur anywhere in the body and causes nerves to become weak, leading to muscle pain. Inflammation plays a role due to damaged renal cells activating both the innate and adaptive immune system cells. So, in chronic pain conditions, preclinical and clinical research has shown the role of the immune and nervous systems. Nerve cells transfer information of potential threats, like heat or harmful chemicals, to the spinal cord. The neurons in the spinal cord receive the information and is transmitted to the electrical signals and can be turned up or down, and whether it should be sent to the brain. When chronic pain develops after a nerve injury, the microglia amplifies the signal. When it reaches the brain, it gives the feeling of pain. T cells, our key infection fighters, change in the immune system with changes in chronic pain and DNA markers. Continuous pain trigger a stress response and lead to long-term stress in the body if the pain becomes chronic. This is why it's important to decrease your actual stress that you feel. Isn't that all interesting? I hope you learned something. I send you gentle hugs and support. Love you. Suppress antigens. Jeez. The immune system. Put her hip back in. How about immune and nervous system. Dang it. And induce demyelination and induce